Welcome back to Mayo Clinic Radio. I'm Dr. Tom Shives.
And I'm Tracy McCray.
Well, it's still early, but the flu season is already off to a bad start.
Here to talk about the flu and other infections, including whooping cough, is infectious disease specialist and vaccine expert, one of our favorite guests, Dr. Greg Poland. Welcome back to the program.
Oh, good to be back.
So, Dr. Poland, is it shaping up to be a bad one, this flu season?
It already is a bad one.
Really?
It's not going to be a bad one. It's a bad one.
Because not a good match, or
well, several reasons. One is we have not had the season start off as an influenza B season for 3 decades, so that's an issue for kids and infants.
Because they're not as immune to B as they are to A.
Right, they have not been exposed to it the way us as older adults have been exposed to it.
Okay, so that's one reason.
The second reason that we have is, as you say, the match. And there's a subtlety here. Remember that the vaccine has 4 different vaccine viral strains in it, okay? So the H1N1 strain, the match is essentially 100%. For one of the B strains, essentially 100%. For H3N2, about a 35% match. For the B Victoria strain, the one that's causing most of the problem right now, that match is about 60%. Now, what that means is that it's not a perfect match, A, but there's still some coverage. People have the tendency to think, oh, well, it's only 30% or 60%. Why should I bother getting it? So that you don't get pneumonia, so that you don't get hospitalized, so you don't die.
We're in the middle of January. What are the statistics we have so far this season?
So the estimate is there have been already about 10 million illnesses in the U.S. About 87,000 people have been hospitalized. And really tragic and sad, Tracy, is that people that were here among us just a few months ago, almost 5,000 of them are now gone, have died because of flu, a disease that we know how to prevent and we know how to treat.
It seems like the statistics show that there have been a fair number of pediatric deaths. Is that because it's a B strain?
Exactly, Tom. There have been about 32 pediatric deaths, about 2/3 of those due to this B strain that's circulating.
Now, I read on a couple of cases, a young girl in Iowa went blind from the flu. Hadn't heard that.
Yeah.
She got very sick, almost died, ended up, she's alive, but she's blind.
Yeah, that is a very, very, very rare complication. It does happen, and it relates to an encephalitis, an inflammation of the brain. And in this unfortunate case, it affected the optic nerves and pathways. And so this girl lost her sight.
11-year-old boy in New York recently died, and his mother maintained that he had the vaccine. I guess we don't know when he had the vaccine.
Yeah, there's some controversy over that she may have been referring to a dose he got last March, which would not be the dose that he should receive this season.
When is it too late to get the vaccine?
It's never too late to get it for that season. Mm-hmm. So we give the vaccine all the way up until it expires, which is usually June 1st. One thing different about this season is it started very, very early. It started in the South. There's a pediatric hospital in New Orleans that had between July and October had 1,200 hospitalized cases.
Wow. So even a good match or not a good match, you have always maintained and always told us that if you get vaccinated and if you get the flu, it will be less severe because you have had the vaccine.
Exactly right. Now, we're talking at a population level, right? There are some people who may be so frail or who are immunocompromised where that may not hold as true. But when we look at a community level, at a population level, getting a vaccine, even if it's not a perfect match, offers some cross protection, some crossover such that the antibody will affect that virus, even if it's not a perfect match, so that you don't get as ill, as sick.
You have advocated for so long for people to get the vaccine. But isn't it true that only about 50% of adults in this country get the vaccine?
It's so frustrating. There's several interesting things, and this seems to hold true across all vaccines. Women get them at higher rates than men. Older people get them at higher rates than younger people. Healthcare providers are not very good about getting their vaccines, which is a real paradox. Pregnant women are not good at getting influenza vaccine.
And it's extremely important for them, isn't it?
Very important. I mean, we see deaths of otherwise healthy pregnant women and hospitalizations and loss of their baby as a result of flu.
How do you know if you have the flu? And because norovirus is going around in my neck of the woods, that is not the flu. So let's talk about both of those.
Yeah, we use the term the flu, and it refers to everything, every illness in the wintertime. The flu, or influenza, is a distinct clinical syndrome of high fever, muscle and joint aches, and cough, sore throat. It is not a runny nose. It is not diarrhea. It is not feeling worn down. It is not nausea.
And how about compare that to the norovirus?
The norovirus is just the opposite. It's nausea, vomiting, and diarrhea.
And what about getting tested for the flu? If you feel like you may have the worst cold ever, should you go in and get tested?
Yeah, I mean, I think if you are pregnant, if it is a young child, if it's an older adult, if it's somebody that has any kind of comorbid illness where this could be a complicated case of flu, absolutely get in as soon as possible. We ideally like to see those people within 48 hours of developing symptoms. So you don't wait around in those cases to see, am I going to get better or worse? What about for you and I? Working people, otherwise healthy. If it's a mild case and you're not developing, any particular problems, rest, stay at home, fluids, etc.
Chicken soup.
Chicken soup actually has some data behind it to show that it helps.
All right, so we know that you have those 3 antivirals available. Tell us about how effective they are, when you use them, and would you ever use an antiviral medication if you hadn't done a test that was positive? In other words, you were guessing that they had the flu.
Yeah, so let me kind of take those in order. All of the viruses circulating in the U.S. at this point are susceptible to all 3 antivirals. So we're not really seeing any resistance. That's number 1. Number 2, as you mentioned, we have 3 different kinds. The newest one, called baloxavir, is a single dose. And within 24 hours, the viral titers in the body are tremendously reduced, and people get better very rapidly with that. So there's no reason to delay treatment. We want to see those people within 24 to 48 hours. There's an oral medication called Tamiflu, and then there's an inhaled medication called zanamivir. In terms of testing to see if you have flu and if you should be treated, it depends on the circumstance. So in July, I would test because there weren't a lot of cases. Right now, in the midst of an outbreak, if you have a clinical syndrome that looks like influenza, you just get treated.
So the new one is Xofluza, baloxavir, and
Yes.
Is that oral?
It is. It's oral.
Okay, but you have to take it within 24 to 48 hours of
48 hours.
onset of the disease,
Correct.
of the flu. And it only reduces your symptoms by a day or 2, right?
By about, it reduces it 24 hours faster than the other medications.
Okay.
And
Expensive?
And it is expensive.
You have
There's
one
a price to pay.
You have one in your pocket?
I don't, sorry. But that's because I got the flu shot.
Yeah. Can you get the flu twice in the same season?
Absolutely, yes. Remember, there are 4 different strains that predominate in a flu season. We have all 4 circulating, not at the same levels or rates, so absolutely you can.
All right, the flu season could be a bad one. It's not too late to get vaccinated, and if you do get sick, the flu will not be as bad if you have had the vaccine. We are with vaccine expert, infectious disease expert, Dr. Greg Poland. Time for a short break.
When we come back, we'll find out why whooping cough has made a comeback and get an update on the HPV vaccine.
Welcome back to Mayo Clinic Radio. I'm Dr. Tom Shives.
And I'm Tracy McCray.
Do you want to say you're listening to Mayo Clinic Radio?
You're
on
listening to
Clinic?
Mayo Clinic Radio at the Mayo Clinic News Network.
Oh, that's
Very
pretty
good. You have been a guest enough times.
All right, we've gotten an update on the flu, and now it's time to talk about the whooping cough. Why in the world are we seeing cases of whooping cough?
Yeah, well, we see them most winter seasons, number 1. Number 2, this is a bacteria we're talking about now, not a virus. Number 3, we've encountered a really interesting issue. Number 1, the bacteria has probably subtly mutated, something we don't generally see in regards to vaccine pressure on that bacteria. Number two, remember that we switched to a different kind of pertussis vaccine. Not the whole cell vaccine anymore, but a new acellular pertussis vaccine. That vaccine does not induce high enough antibody titers to last over a long period of time. In fact, by about 4 years, protection probably wanes.
Oh, so your immunity to the bacteria actually wanes, and you're more susceptible.
Right. And then the third thing is low immunization rates. So we're sort of battling all three things simultaneously. In 2014, we had 33,000 recognized cases. Last year, about half that, about 16,000. We don't have any numbers yet for this year.
It's a big deal. I mean, people crack their ribs from whooping cough.
Well, with my young son's permission, when he was, about 11 or 12 years old, and here I'm an experienced physician with this, I heard him cough when he went to bed, and I'd never heard that cough from him. He didn't have a whoop, but it was a very unusual cough, and I said, he's got pertussis.
How old was he?
He was 10, 11 years old.
Really?
Cultured him the next morning. It was positive. Got him on, and so nobody would have gotten on antibiotic therapy any faster. That kid coughed for, and the older clinicians will call it the 100-day cough illness. He coughed for almost 100 nights.
And he started treatment right away.
Within 18 hours.
Wow. And so is the message that if you're getting a pertussis vaccine that you just need to get it every 4 years?
No.
Okay.
That's. I wish that were an answer in a sense that easy. We need to have a more immunogenic vaccine, but without the reactogenicity of the whole cell. Right now, of course, kids have a recommended schedule, but for us adults, there's a dose recommended at adolescence, and then in adulthood, a one-time dose. The only exception is pregnant women again. They should get a dose of it with every pregnancy.
So it's part of the DPT, the diphtheria, the pertussis, tetanus vaccination. Yes. You're supposed to get it 2 months, 4 months, 6 months, somewhere 15 to 18 months, and also 4 to 6 years.
Correct.
But then you're suggesting that maybe a booster later on.
And then what they get is just the acellular pertussis, or if they're younger, TDAP. But for us adults, we get acellular pertussis as part of our tetanus shot.
Now, this is a highly contagious disease, too, isn't it?
It's fairly contagious, yes.
And babies, most of the deaths occur among babies, right?
That's exactly right.
But they haven't been vaccinated, or
they often have not received enough doses yet by the time they get infected. So, for example, we recommend that the parents be immunized to protect that baby, because they may have a dose at 2 months, another dose at 4 months. They're not really protected until 3 or more doses have been received.
So it must be very frustrating for you that some parents and more parents are not getting their kids vaccinated.
It is immensely frustrating. I cannot tell you the angst of counseling a parent whose child has died, or a grandmother who has died of a disease that could be prevented or had a significant complication. That family, that community, that church is forever changed by the loss of that person. And it's maddening that it has to happen every year, every community. And I think in part it's because people think, well, whooping cough, isn't that a disease of the past? I haven't seen that. Must not be a very common or dangerous risk. And exactly the opposite is true.
I'm interested to hear that one of the theories is that it has changed, it has mutated.
Yeah.
Tell me more about that. How can we know if that's true or not?
Well, the Australians have actually been looking at and typing these various strains, and they have one of the toxins that this bacteria produces is called pertactin, and they've noticed that some of the strains are pertactin deficient. So a vaccine against that protein, which is no longer present, isn't very helpful.
Where is this campaign of misinformation about vaccines coming from?
It has always been present. I published an article, must be about a decade ago, in the New England Journal called "The Age-Old Struggle Against the Anti-Vaccinationists." This started with smallpox vaccine back in the time of George Washington and before. People just have this almost sort of indwelling sense that if they're otherwise healthy, why take a vaccine to prevent a disease they don't yet have.
No.
And so and of course, there are low-grade fevers, sore arms, et cetera, and they misinterpret that as something dangerous. Or they, with Andrew Wakefield and the MMR vaccine, misinformation gets propagated, and people who are not, very scientifically sophisticated will grab on to that as a reason to not get their vaccine.
Yeah.
You never discount the power of a good conspiracy scare.
Yes.
Also, what that does to humans in our minds.
Yeah.
We are running out of time, so let's move on to HPV vaccine.
Yeah.
What did you want to address on that issue?
Well, I think the issue with HPV vaccine is for people to recognize that once one becomes sexually active, essentially everybody will get infected. Now, fortunately, most of them will resolve that, but in the U.S., about 33,000 new cancers a year from that virus. This vaccine protects against the 7 different cancers that can be caused by this virus and the anogenital warts that occur. The problem is immunization rates are too low. Again, women do better than men. Women are about up to 55% or so of them have been immunized, about 45% for men. Just recently, they have raised the age at which that vaccine can be given to age 45. Used to be limited to people below 26 and below. Now up to age 45.
So I did read recently that adults between the ages of 18 and 26, this is boys and girls, men and women, vaccination rate has increased from 22 to 40%.
Yeah, that's
pretty good, but the goal is 80%.
Well,
so we got a ways to go.
100%. But,
All right,
and
now,
these are sexually transmitted diseases, by the way.
Yes.
the pneumonia outbreak in China, why should we be concerned?
This is really interesting to those of us that study this virus. This turns out to be a relative of the coronavirus family, the same family of viruses that caused SARS and MERS. This started back in December in Wuhan, China, at a live animal market. This probably was transmitted from bats to civet cats, which are eaten over there and slaughtered and are for sale. There have not been very many cases. There have been no cases in the last 10 days. They closed the market down. And in this case, the Chinese were very forthcoming with what was happening. There's been very little transmission, no intra-family transmission, no healthcare worker transmission. So it's a new virus or a new virus form, but it does not appear to be highly transmissible.
And there has been no human-to-human transmission yet,
well,
correct?
None that can be documented.
Okay.
If you're traveling to that area, or is that of concern?
It is. CDC has put out a travel advisory in terms of any sort of fever, cough, illness. It is a virus, if I didn't mention that. So it's a viral-like syndrome with a viral pneumonia that has occurred.
All right, Dr. Greg Poland, we know the flu season is underway and it's likely to get worse. It's already been pretty bad. Many more young people are getting the HPV vaccine. And by the way, it is a cancer vaccine. That's good news.
Yeah.
And finally, whooping cough is making a comeback, but you can prevent it with a DPT vaccine.
Our thanks to Mayo Clinic infectious disease specialist and vaccine expert, Dr. Greg Poland.